Welcome to the deep dive. Today, we're getting into something pretty fundamental, musculoskeletal trauma.
Yeah, injuries to bones, muscles, ligaments, tendons, things we all experience to some degree.
Exactly. And we've got some interesting source material here. It's actually from a pathology final exam review for healthcare students.
Right, so it's digging into the core knowledge.
Our mission, then, is to pull out the key info on how our bodies handle these injuries, make the healing process understandable, and look at what can go wrong.
It's fascinating stuff, really, how the body repairs itself.
Okay, let's start right at the beginning. Bones. We think of them as, I don't know, solid girders, but they're more complex than that, aren't they?
Oh, absolutely. Bone's a living tissue. You've basically got two main types. There's the cortical bone, that's the hard, dense outer layer, gives the strength.
The shell, kind of.
Yeah, like the shell. And then inside, you have trabecular bone. It's more like a sponge, lighter, with spaces for marrow.
And both are pretty important.
Critically important for the bone's overall structure and function.
And it's not static, right? There are cells constantly working in there.
Definitely. Three main types you need to know. Osteoblasts think B for building. They build new bone.
Ooh.
Then osteoclast C for chewing, maybe. They break down old or damaged bone, essential for remodeling.
Ah, the cleanup crew.
Sort of, yeah. And then osteocytes. They're the mature cells living inside the bone, kind of maintaining things. They all have to work together.
Right. So the big question, how does a bone actually heal when it breaks? It sounds like quite a process, not just sticking it back together. Our sources list 4 phases.
That's right. It's a sequence. First up is inflammation. Happens almost immediately within hours. You get a hematoma, basically a blood clot forming right at the break.
Like a bruise deep inside.
Exactly. It stabilizes things initially and kicks off the healing cascade.
Okay, phase 1. Then what? Soft callus? That takes days to weeks?
Yeah, soft callus formation. The body starts building a bridge across the gap, but it's made of fibrocartilage. It's soft, like a temporary internal splint. Gives some stability, but it's not bone yet.
Got it. A scaffold.
A good way to put it. Then comes the hard callus formation. This takes longer, weeks to months.
This is where the real bone comes in.
Precisely. That soft fibrocartilage scaffold gets replaced by actual woven bone tissue, mineralized, much stronger. This hard callus really locks things down.
And then the last phase, remodeling. This one can take months, even years. That seems surprisingly long.
It does, but it makes sense. This phase is all about refining. The bone that formed might be bulky or not perfectly shaped. So the osteoclasts and osteoblasts get back to work, slowly reshaping the bone based on the stresses you put on it.
Ah, so it adapts back to normal function.
Right. It aims to restore the original shape and strength, even down to the microscopic level. It shows that healing is happening long after you might feel better.
Okay, that's the bone itself. Let's broaden out now to the different ways bones and the tissues around them, muscles, ligaments, can actually get injured.
Sure, we can group them broadly. You've got bone fractures, obviously, the breaks, and then soft tissue injuries, muscles, tendons, ligaments getting damaged.
Let's talk fractures first. There are different kinds, like closed versus open.
Yeah, that's a key distinction. A closed fracture, sometimes called simple. The skin over the break is intact. An open fracture or compound is where a bone end actually pokes through the skin.
Ouch. Much higher risk of infection there, I guess.
Huge risk, yeah. Then you have different patterns of the break itself. Comminuted means the bone's shattered into several pieces.
Nasty.
A green stick fracture is more common in kids. Their bones are more flexible, so it bends and only breaks partway through, like snapping a green twig.
Makes sense.
Spiral fractures usually come from a twisting force. And stress fractures are those tiny cracks, often from overuse, like in athletes.
Right, okay. And what about the soft tissues? Sprains, strains? They sound similar.
They do, but they affect different things. A sprain is damage to a ligament. The tough bands connecting bone to bone can be a stretch or a full tear.
Oh, okay. Ligaments?
A strain involves injury to a muscle or a tendon, the cord connecting muscle to bone. Again, could be a pull or a tear.
Muscle or tendon for a strain. Got it. And contusion.
That's just the medical term for a bruise. Blunt force damages tiny blood vessels under the skin.
Simple enough. And then there are ruptures, like the Achilles.
Yeah, a rupture is a complete tear of a tendon. The Achilles in the ankle is a common one you hear about.
So how do these things typically happen? What causes these breaks and tears?
All sorts of ways. Falls are incredibly common, obviously, especially in older adults.
Sure.
Sports injuries are another big one. Impacts, twists, sudden stops. Think football, skiing, basketball.
Right.
Direct trauma, like in a car accident or a major impact, can cause really severe fractures, often open ones.
Makes sense.
And don't forget repetitive stress. Doing the same motion over and over can lead to stress fractures or tendonitis, that kind of thing.
Okay, so someone comes in, they've clearly hurt themselves. How do doctors figure out what's going on? Our sources highlight these 5 Ps. What are they?
Ah, yes, the 5 Ps. They're absolutely critical for neurovascular assessment. Basically, checking the nerves and blood supply below the injury site. Super important.
Okay, what are they?
First is pain. Where is it? How bad is it? What kind of pain? Then pallor, meaning paleness. Is the skin cool and pale? That could mean poor blood flow.
Right.
Third is pulselessness. Can you feel a pulse further down the limb? If not, that's a major red flag for circulation.
Definitely.
Fourth is paresthesia. That's abnormal sensations, tingling, numbness, pins and needles. Suggests nerve involvement.
Like your foot falling asleep, but worse.
Kind of, yeah. And the fifth is paralysis. Can the person move the limb, their fingers or toes? Inability to move signals, potential nerve damage, or severe compartment issues.
So these 5 Ps are like an early warning system for serious problems.
Exactly. They help catch potentially limb-threatening conditions quickly. But the full assessment goes beyond that.
What else is involved?
Well, there's inspection, just looking carefully. Is there obvious deformity, swelling, bruising, any open wounds?
Just using your eyes?
Yep. Then palpation, gently feeling the area. Looking for specific points of tenderness, maybe warmth indicating inflammation, or crepitus.
Crepitus, what's that?
It's that gritty or grating feeling you can sometimes get when broken bone ends rub together. Not pleasant.
Yikes. Okay.
Then you assess range of motion. How much can they move the joint? Does it hurt when they try? And, of course, a more detailed neurovascular check, testing specific sensations, checking capillary refill, confirming those pulses really well.
It sounds pretty thorough. Now, we know the body wants to heal, but sometimes things get in the way. What can slow down or mess up that healing process?
Quite a few things, unfortunately. Infection is a big one, especially with open fractures. It just diverts all the body's resources.
It makes sense.
Poor blood supply is another major issue. Healing tissues need oxygen and nutrients, and if the blood flows bad, they just don't get them.
Right, like in diabetics sometimes.
That can be a factor, yes. Also, nutrition itself. You need enough protein, vitamins, especially vitamin D, and minerals like calcium and phosphorus for bone building. Malnutrition hinders healing.
Okay. What else?
Smoking is a really significant negative factor. Nicotine constricts blood vessels, reducing blood flow.
Ah, another reason to quit.
Absolutely. Older age generally means slower healing, and certain medications, particularly corticosteroids, can suppress the inflammation needed to kickstart healing and weaken tissues.
So your overall health really matters here.
Massively. It's all interconnected.
And if healing is delayed or goes wrong, what are the potential complications we might see?
Well, you can get malunion. That's where the fracture heals, but in the wrong position, crooked or rotated.
So it works, but it's not quite right.
Exactly. Then there's non-union, where the fracture just fails to heal together at all. Requires more intervention. A really dangerous one is compartment syndrome. This happens when swelling inside a closed muscle compartment, like in the lower leg, gets so bad that the pressure cuts off blood flow.
That sounds like an emergency.
It is absolute emergency. Need surgery fast to relieve the pressure, or tissue and nerves can die. It leads to ischemia, lack of oxygen.
Wow. Okay. Anything else?
Another serious, though less common, one is fat embolism syndrome. After major long bone fractures, like the femur, fat globules from the bone marrow can get into the bloodstream and travel to the lungs or brain.
That sounds potentially fatal.
It can be, yes. Requires intensive care.
Okay, so lots that can go wrong. How do doctors actually see the injury to diagnose it properly? Imaging must be key.
Oh, definitely. X-rays are usually the first step for suspected fractures. Quick, easy, shows bone breaks well.
Standard procedure.
Yep. But for more complex fractures, or to get a better look at the joint surfaces, a CT scan computed tomography is often used. It gives detailed cross-sectional images.
Like slicing the bone digitally?
Kind of, yeah. Then for soft tissues, ligaments, tendons, muscles, cartilage MRI, magnetic resonance imaging is the gold standard. It shows those structures much better than X-ray or CT.
So MRI for that suspected ligament tear.
Exactly. And sometimes a bone scan is used. It involves injecting a radioactive tracer that highlights areas of increased bone activity, which can help find subtle stress fractures or infections that aren't obvious on X-ray.
Okay, so a range of tools to look inside. What about blood tests? Do they help?
They can provide useful context. A CBC, complete blood count, can show signs of infection like a high white blood cell count or anemia, which might affect healing.
Right.
Checking electrolytes, especially calcium and phosphorus levels, gives information about bone metabolism.
Mm,
Creatine kinase, or CK, levels go up when there's significant muscle damage.
okay.
And inflammatory markers, like CRP and ESR, can indicate if there's significant inflammation or infection somewhere in the body.
So the tests add pieces to the puzzle. Once you have the diagnosis, how do you treat these injuries? It must vary a lot.
It really does. Pharmacologically, using medications, pain control is usually front and center. That might involve NSAIDs like ibuprofen or sometimes stronger opioid medications for severe pain.
Managing the pain.
Crucial. For open fractures, antibiotics are essential to prevent or treat infection. And sometimes anticoagulants, blood thinners, are used to reduce the risk of blood clots, like DVT, especially after major surgery or long periods of immobility.
Makes sense. And what about non-drug treatments? I know rice is common.
Ah, yes, rice. Rest, ice, compression, elevation. It's fundamental first aid for many acute injuries. Reduces swelling, pain, inflammation.
Good old rice.
Can't beat it sometimes.
Yeah.
Then immobilization is key for many fractures. That means casts or splints to hold the bone still while they heal.
Right.
Sometimes traction is used, applying a gentle, steady pulling force to help align bone fragments, especially before surgery.
Okay.
And then there's surgery itself, often needed for unstable fractures, open fractures, or complex joint injuries. The goal is usually ORIFF, open reduction, and internal fixation.
Meaning?
Open reduction means they surgically open the site to realign the bones perfectly. Internal fixation means they use hardware plates, screws, rods, pins inside the body to hold the bones together while they heal.
Fixing it from the inside.
Exactly. And you absolutely cannot forget physical therapy. It's vital after almost any significant musculoskeletal injury or surgery to regain strength, flexibility, and get back to normal function.
PT seems crucial for recovery.
It really is. You
But-
need that guided rehabilitation.
This has been incredibly informative. So to kind of pull it all together, what are the absolute must-remember points from this deep dive?
Okay, key takeaways. Remember the 4 stages of bone healing: inflammation, hematoma, soft callus scaffold, hard callus real bone, and that long remodeling phase.
Got it.
Know the fracture types, simple closed versus open compound, and patterns like commented many pieces, green stick kids, spiral twisting, stress overuse.
Okay.
The 5 Ps for neurovascular checks are vital: pain, pallor, pulselessness, paresthesia, paralysis, checking nerves and blood flow.
Crucial.
Remember things that delay healing: infection, poor blood supply, smoking, poor nutrition, age, steroids.
Right.
Be aware of major complications. Malunion heals wrong. Non-union doesn't heal. The emergency of compartment syndrome and the danger of fat embolism.
Serious stuff.
Know the tools: X-ray for bones, MRI for soft tissue, CT for detail, bone scans for tricky things, plus blood tests like CBC, CK, inflammatory markers,
Diagnostics.
and treatment basics: RCE, immobilization casting, surgery like ORIF, pain control, and absolutely essential physical therapy.
And any final red flags, things that mean get help and now W.
Yes, definitely. Absent pulses below the injury, severe pain that isn't getting better with medication, and cyanosis, a bluish tint to the skin indicating lack of oxygen. Those demand immediate medical attention.
Excellent summary. This really gives us a solid handle on musculoskeletal trauma, straight from materials designed for healthcare pros. It's quite something, the body's response system.
It is. And hopefully understanding these processes helps you appreciate what's going on if you or someone you know experiences an injury, and why proper care is so important.
Absolutely. It leads to a final thought, doesn't it? When you think about these complex healing stages, all the things that can go wrong, the factors influencing recovery, what does it really tell us about how resilient our bodies are, but maybe how fragile too?
That's a great point. There's this incredible capacity to heal, but it relies on so many things working correctly.
And maybe makes you think a bit more about how lifestyle choices, nutrition, smoking, activity levels play into that fundamental ability to repair ourselves day in and day out. Definitely food for thought. Thanks for joining us on this deep dive.